Hi, welcome to our next presentation in our athletic training education series. This particular uh, presentation will talk about learning environments. I think some of this stuff is pretty common knowledge, but I just don't want to assume anything. So when we're talking about an athletic training professional education program, we were talking about three main learning environments where students will learn. The typical one is at a classroom, which I think all of us understand what we're talking about here. It's also known as didactic. You'll see that in some of the literature, and maybe when you're doing some research, you might need to use the term didactic. I don't know where our professional programs are going to go in the future. I don't know of too many of the professional programs or even the post-professional programs that are using the online environment all that much. I've had some discussions with some of my fellow athletic training educators about why can't we do a blended online type program. Have some of the coursework online, and then the practical or the laboratory and the clinical settings obviously would be in a campus setting. So we'll see where the future takes us with that. Obviously, I just said the laboratory. Laboratory is, most of you have probably done all these things, so I don't need to explain them all that much, but this will be a classroom time set apart just for clinical skills, can be for professional development type things. So it is a little bit different. It is still a classroom, but it is designed to help students work on some of their clinical skills and abilities. Then the last one is clinical setting, which we'll talk about in just a little bit. That's the clinical education, and I'm going to spend some time diving into the clinical education. Our book about this from Dr. Widener, the Athletic Trainer's Pocket Guide to Clinical Teaching, excellent book. It's a couple years outdated already, and that's the problem with textbooks. They typically are outdated. I think there's probably some new, more updated journal articles in our Journal of Athletic Training and in the Athletic Training Educators Journal. So I would suggest that you use those sources too. But this book is really good. And one thing I want to talk about with this textbook, I want you to notice the way that the authors in the textbook write. They support their information with citations. Now, they cite differently than what we require in our graduate program, which is APA. They use AMA, the American Medical Association citation. But it doesn't matter. They're still supporting their information with references. So when you turn in formal assignments, I expect that you support what you're writing with references, just like they do in that textbook. They provide good examples of how they do that. Now, format, again, is not the same, but the style that they're supporting their information with evidence. Again, I'm calling this evidence-based academics because you are supporting what you're writing with evidence. And our evidence in academics is journal articles and other reliable resources. Most of the stuff in this presentation is pretty straightforward. I don't think it's too surprising, but I think it's important for us to remember the purpose of clinical education. Why do we do it? And remember, the athletic training student is not a replacement for a certified athletic trainer. They are students. They're students number one, and they should be treated as students, should not be placed in positions where they are making decisions that they're not trained to do or are they legally allowed to do in most states except California. Okay, so as the CIE stands for Clinical Educators, Clinical Instructor Educators Workshop. It's a workshop designed to train the trainers, so the people who train preceptors on how to be excellent preceptors for students. So as they say in the workshop, students need to learn the psychomotor skills, which now in the new current competency, those are the clinical integration proficiency, or CIPs, SIPs. Those are the psychomotor skills of their trade while encountering and assimilating the interpersonal skills, moral, reasoning, socialization, and attitudes distinguishing their profession's working environment. So that's a lot in there. So first talk about the skills. The skills would be taping, how do you do a Lockman's or anterior drawer test both at the knee and ankle, and all those type of psychomotor skills that we need to know. But there's also a lot of other things that we need to know and that we need to teach our athletic training students, our future peers, the interpersonal skills. How do we deal with the patient who's injured? How do we deal with a coach when you tell them that their student athlete is injured and out for quite a long time? How do we deal with other staff members that you have some personality issues with? What about the moral reasoning? Should we allow this patient to play or practice, or because you're getting a lot of pressure from the coaching staff to put that student athlete or that patient into a game when you believe that they shouldn't be, because they are, it can be a detriment to their health. So those are moral reasoning. We have to teach our students about that. Socialization, I think I've talked about in one of my other presentations, that this was my area in my dissertation, was how do we socialize our peers, soon-to-be peers, into the profession of athletic training. There is a certain way to do things. There's attitudes and beliefs and all those type of things, which we're talking about, and these other things in our purpose of clinical education. What is the right way to do things? And sometimes those things are the right way, and some things we socialize people into the wrong things. And my opinion is one of the ways that we socialize ourselves and others, athletic training students and athletic staff, the coaches and all that, is that we think that we have to be at work all the time. We don't need to be at work all the time. It's not our job to live for our job. That model needs to be broken. We also need to socialize ourselves out of the attitude that we have to take these poorly paid jobs just because they have to have a job. Only way we're going to increase our salaries if we make some changes, and it has to start with us. Okay, I'm off of my soapbox now. I think I'm done with that. Some more purposes of the clinical education is that we're trying to take a student who's a novice, doesn't know really much of anything. We all been there. I remember what it was like to first start in an athletic training room, starting to learn how to tape. First start how to learn how to tape, cut tape, rip tape, then become competent in taping. And then all the other things that we do as athletic trainers. So it's the role of everybody in athletic training education, going back to that term again, the professional programs, to move them from being a novice all the way to a competent entry-level practitioner, because that's our goal by the time they finish their professional program. And in the clinical environment is the, quote, real-world laboratory. So we are exposing the student to controlled situations that they would encounter in the job that they will do in the future. Some of the disadvantages of some of the restrictions that we have now in the professional programs is how much autonomy do we actually give athletic training students. That is the challenge that we run into, whereas back when I was a student, I hate that term, but back when I was a student, I was still under the internship program where I was allowed to travel without any supervision, which was, I think about it now, is how stupid of that. What kind of risk was I putting myself in for liability issues, the school for negligence and liability issues, the patients, and all those type of things. It's just, I wasn't ready to be out on the road by myself. I barely had enough experience. So that's the purpose of the supervision, which our textbook talks about, and hopefully you've had some meaningful discussions with fellow athletic trainers, and even you may have these discussions if you go into the role of being like a program director or clinical coordinator with your athletic training staff and the athletic department. So just some interesting things to ponder. Some more stuff about our clinical education design. We need to do teaching. We need to combine our get my brain working here again. The didactic and clinical experiences. They should be happening at the same time. We should, when we design our curriculum for a professional program, is what's happening in the classroom and in the laboratory should coincide with the clinical experiences. It's not always going to work out because more than likely the clinical things are going to happen a lot sometimes before students get to them in the classroom setting. That's why some programs in their like introduction to athletic training, whatever type class that is called, maybe a class that students take before they are even admitted into a program, will briefly go over, modalities. What is ice? What is heat? What's the indication, contraindication? Those type of things. So at least the athletic training student, when they are actually admitted into a program, have some background of ice, heat, ultrasound, and all those different things. So the question is, where do we do assessment? Where do we do the modalities course? Do we do that early in the program, they're teaching in the classes, or do we do it later? Those are the challenges. When do we do rehab? And so those are the challenges when you're designing a professional program, regardless of the level, if it's a master's or an undergrad program. And that goes with the second point. It's how's theory and practical experience marry one another? When do they come together? Another thing is a student, and it's common sense, you shouldn't ask a student to do a skill that they've not been taught, they haven't demonstrated competency in at all. I don't know what your athletic training education was like. I was not allowed to tape an athlete until I had demonstrated that I can do that particular tape job correctly, and that's true of setting up ultrasound. It's true of setting up electrical stimulation, all the different types of it. It's true of pretty much everything. And it still needed to be supervised by my athletic training mentor, preceptor. And so the way we should progress knowledge skill is, first, it should be done in a formal instruction in a classroom. So we should teach them the theory. Laboratory setting, we should have them do practical evaluations, such as I was just describing. Okay, set up a scenario for them, for a student. You give them a scenario, have them do whatever you need them to do. It can be mock injury assessment, it can be mock treatments, and those type of things. So this can be done different ways. Then when they're out there being supervised by their preceptor, and an athlete or a patient comes in, it's not an emergency, and they've been working on lower extremity injury assessment, and a patient comes in with a lower extremity injury. You can have the athletic training student do the injury evaluation with your supervision. Just don't let them go. That's not what you should do. I mean, I've been guilty of that myself, so I'm not saying I'm perfect. That's the reality of it. Last part is I'm going to have you read. I have this document in our class. Download it. We're going to talk in a forum about what's the future of our professional education. As you'll read in this document, that this document proposes that we move our entry level, to use that term, professional education at the graduate level. They make a pretty strong case for that. So I want to get your opinion on that. Where should we, what should we do with our professional education? But you need to read the document first, and they make some very good points. And I'm going to probably ask a couple other questions about our future of our education and some other thoughts that are going around with athletic training in general. Just like to get your opinion on these type of things, because we all need to have a voice in this. We're all stakeholders in our profession. This is our profession, and if this is something you're very passionate about, this is something that you need to get involved in at your state, district, and national level for these type of decisions, because it's going to affect us all. It's going to affect a graduate program like this. If we move to a graduate level is entry level, and then what do I do with this type of program? I have to make changes to this program. Do I eliminate this program? So it's things down the road that I have to keep at the head of my vision, so I can be ahead of what's going to happen and make the appropriate changes. I look forward to hearing what you have to say, what your thoughts are about our future of our professional education.